Hello guys, welcome back to our channel. In previous topic we have discussed about the anatomy of thorax, physiology of lung, and also the general assessment, a quick review for infants and pediatrics. In today's topic we are going to discuss about the measurements in cardiorespiratory physiotherapy. Number one, it's chest expansion measurement. The purpose is to assess the mobility of chest wall and the efficiency of respiratory mechanics, particularly in conditions like COPD, ankylosing spondylitis, post-thoracotomy, scoliosis, etc. Procedure: use a measuring tape. Ask the patient to stand or sit upright, and also exhale fully, inhale maximally. Measure difference in the chest circumference with the help of inch tape. Measurement site will be axillary nipple line, xiphisternal line. If it's axillary line, mid-axillary line in the third intercostal space. 4 to 5 centimeter will be increase. The expansion will be present if it's normal. Nipple line at the level of fourth intercostal space, that is 5 to 7 centimeter. If it's excessive, then it's considered to be as normal. If it's reduced or if it's very excessive, means it is considered to be as abnormal range. Xiphisternal just below the xiphoid process, 6 to 8 centimeter only. Reduced expansion, restrictive lung condition, pain, stiffness, and neuromuscular dysfunction. Yes. Exercise tolerance testing. In exercise tolerance testing, we do have 6-minute walk test, 10-minute walk test, 12-minute walk test, and etc. The purpose is to measure the functional exercise capacity and also the aerobic endurance. Used in case of COPD, heart failure, post-surgery, and pulmonary fibrosis, etc. The procedure is 30-meter flat corridor is marked with the even surfaces, not in the uneven surface or slippery one. Patient walks as far as possible in 6 minutes. Monitor distance covered in meters, SpO2. Partial, that is, should not drop less than 88 degree. Heart rate and BP. Dyspnea scale, Bogue REP scale. Interpretation will be 300 m, that is greater than or less than poor functional status. Improvement 30-meter post-treatment is clinically significant if it's less than. Post-operative assessment, range of motion. Joint commonly affected. Shoulders, especially post-thoracotomy or chest tube insertion. Cervical and thoracic spine, post-surgery or prolonged ICU stay. Use goniometry to measure the joint angles, focusing on the flexion, extension, abduction, adduction, and rotation. Limitations in the range of motion may arise from the pain, also due to incision, scar adhesions, guarding, etc. Muscle strength assessment. Manual muscle testing from 0 to 5. 0 no contraction, 5 full strength assist resistance. Focusing on the diaphragm, C3 to C5. Sniff test. Ask the patient to sniff, or the abdominal rise. Accessory muscle usage, sternocleidomastoid, scalenus. UE and LA muscles are bedridden and post-OP patients will be using. Baseline strength helps track post-operative weakness, deconditioning, or critical illness myopathy. Clinical use helps design individualized physiotherapy protocol, monitors progression or improvement in the range of motion, strength, and functional capacity. Aids in goal setting for the discharge, home program planning. In next topic, we'll be discussing about the physiotherapy, physical treatment. Okay. Happy learning.